Thank you. How would you like your life to be? Do we ask that question enough in health and care? No, was the answer we got back in 2014 when we asked local people. In public health, we were hearing things like, the focus is always on what's wrong with me. I'm expected to fit with whatever service is available. And they don't seem to care about what matters to me as a person. We were also hearing that the people in our communities who were facing the most complex social challenges around issues such as poverty, housing, mental health, and social challenges such as isolation were falling through the gaps between our services. And that this was especially the case in our rural areas. This really worried us, and we wanted to try a different approach, a coaching approach. What if we had a team of people who weren't recruited for any specific qualification, but because they demonstrated a fantastic ability to nurture the strengths of individuals? And then once they were employed, we trained them to coach, to do with rather than to do for. We didn't want people falling through the gaps, so we also thought, what if the only eligibility criteria for this team was a person experiencing social complexity, but who was also demonstrating a willingness to achieve a better life? And really importantly, we wanted to recognise that everyone is different, and for some people, change will take a long time. Therefore, what if we didn't limit the number of weeks we could work alongside someone? Clearly, we recognised the risks of creating a team in this way, and so did others when we shared our idea with them. What? No eligibility criteria or time limit? You'll have waiting lists before you know it. Yes, we understood that people were saying this, but at the same time, we had an optimism that if the number of weeks of support we could give someone was defined by that person's situation rather than by us and the service, surely they might be able to achieve better outcomes and require less support in the future. Some colleagues also said they would like an in-tray to make it easy for them to refer people. We understood that staff were under pressure and referral processes needed to be efficient. But actually, what we really wanted partners to do was to talk to our coaches about possible referrals, to build a relationship, and to paint a picture of an individual and their life. We didn't think it was right somehow to only define a person by the range of options on a form or the square box of an in-tray. We're people. We're all different. So we did it. Wasn't easy, but we did it. In 2017, our newly formed team of 28 health and wellbeing coaches started working with the people of Cumbria. The main way we assess the effectiveness of the team is to measure whether or not they have helped a person to move closer towards what their idea of a good life is. Secondary to this are indicators such as changes to use of statutory health and care services. They're less important, but they are there. So, bearing in mind that success is person-specific, what proof do we have that this approach actually works? Well, I'm going to talk about someone who I'm going to call John. The team first met John in July 2018, when he was referred to them via the Fire and Rescue Service. There were safeguarding concerns linked to dilapidated housing conditions, and Environmental Health were considering condemning his property. He was hoarding, he had no hot water, and at times no electricity. This resulted in poor hygiene and little self-care. All the windows were boarded up, and the house smelt strongly of damp, urine, and faeces. Conditions were particularly harsh in the winter, when John would use small electric heaters as his only source of heating. It was a terrible fire risk. Over the years, there have been frequent contacts with adult social care, as well as multi-agency attempts to engage with John. Contacts included the police, ambulance service, A&D, housing, the local council, and community mental health services. He has been treated in hospital for conditions linked to malnourishment, and his GP confirms that he suffers from poor mental health and that he self-medicates with alcohol. John also had significant arrears with council tax and was facing court action. He had been described as very hard to engage. John did not have any learning difficulties, but it was recognised that he had struggled to maintain his home since his parents had passed away. So a health and wellbeing coach went to see him and very quickly realised that John needed a slow fix approach to build trust. He had no trust left. It began with a conversation on the doorstep. Confrontation regarding living conditions was avoided, and the focus was solely on what John's situation was and what John wanted to achieve. Then about coaching him to make the changes that he wanted to make, not what we wanted him to make, what he wanted to make. And do you know what John wanted to achieve? It was nothing to do with his housing or his health. He wanted to learn how to use the internet, so he could watch nature documentaries and explore places using Google Earth. So we focused on that and built some of the other things around it. The health and wellbeing coach helped John to map information and emotions, to help him understand the links between his situation, his feelings, and his behaviours. Through doing this, the coach realised that John couldn't see properly, so we also encouraged him to get his eyes checked. We also taught John planning techniques to help him organise and manage things like health appointments and paying his bills. But what really helped John more than anything else was the consistent emotional support and reassurance that was given over a period of time. It was only through developing this relationship that John started to regain his trust in others. Well, where is John now? He's been to the optician and has glasses, so can see properly for the first time in years. He's attended an adult education class and can now use computers. He's in a new home and has internet installed. This is not only allowing him to watch nature programs and to use Google Earth, but he's also paying his bills online. So no more getting behind with his council tax. And you know what? He's even planning his very first holiday. There are still some signs of hoarding, but the health and wellbeing coach continues to provide support around this. And as for those secondary success measures that I talked about earlier, social care has had no further contact from other services about John since the health and wellbeing coach has been involved. Since January 2017, the team has worked with over 3,000 people. I asked the team to help me summarise the most important lessons learnt to date from their work, and this is what they told me. Don't fit into the box, but think outside of the box. Let the person define what they want to achieve. Look for long-term solutions within the person's community and their networks, and introduce them to what is available in creative ways. In rural areas, ultimately there will be gaps in service provision, so support people to create for themselves what is missing. The health and wellbeing coaches are showing that conversations can be powerful. They can create change. So come on, let's all ask someone today, how would you like your life to be? And see where that conversation takes you. Thank you.